Good morning. Welcome to the Inside Job Podcast, Healed Inside Out. I got the doctor back on the mic today. We had some questions from some listeners, and I thought it was great to maybe get those answers live from you, Dr. Johnson. So prayerfully, you ready and prepared?
I'm always ready.
Oh, he stay ready, y'all. I didn't give him these questions in advance. And I think that's a good thing too, because you'll get the knowledge first. I mean, this doctor knows what he's talking about, right? He didn't have to research your questions or anything like that. So we're ready for you. You ready?
I'm ready. I have been researching those questions for how many years I've been practicing
Look.
medicine? 40 years, and a lot of it is just we call having skin in the game.
Okay.
So a lot of stuff is not in the textbook.
Right.
A lot of this stuff, I should say,
Experience.
issues come from women
Okay.
who have taken the time to educate me about symptoms. It's just that if I'm willing to listen, because the symptoms of menopause may appear 10 years before the menopause actually sets in, and we just ignore it as doctors. So 80% of the cases of menopause is actually discovered by patients, our loved ones.
Okay. All right. And then you guys are very familiar with Miss Beautiful Nisa.
Hello.
She back at the table with us this
Podcast
morning.
world. Yes, yes.
Clap your hands for her.
Oh, yes, of course.
You need an
Like Doc
intro.
taking up for you. Like, can we give an applause for her? That's awesome. That's awesome. So listen, y'all, we gonna jump right in it. I have several questions, and then for those of you that have asked for the information, how to contact Dr. Johnson, we will have that at the bottom of the screen, and then I'll also make a post that will have his way of contact and the process and all
Yes.
of those things. That all right with you?
That's great.
All right. First question here. Someone asked, how will menopause affect my sex drive?
Greatly. I think if you look at menopause, the two of the most common things I've dealt with is vasomotor symptoms, hot flashes, night sweats, depression, mood swings. I said being edgy, irritable. And then the other one is the dryness of the vagina and urethral. You may have loss of control of your bladder. But the thing is the sex issue is something that is a hard subject to approach a patient to a doctor. I don't know whether it's being a male doctor, but I think it's just a subject. They don't want to. It's embarrassing. But then again, I had one patient. I said, you know what? It seems like you got something to say to me. She said, I'm having problems having sex, and I don't know who to talk to. She said, well, who do you feel comfortable talking to? He said, she was quiet. I said, would you take this subject to your priest or your pastor? Well, you develop some trust in the caregivers and actually just ask the question, and they should be able to answer these questions, because I think that we call it, the term we use for it is dyspareunia, and that means painful intercourse, and that's the reason why most people don't want to have intercourse, or either their concern is it's too painful. So, I think that got to have a real life conversation, like who's the adult in the room,
Yes.
but come in prepared to ask all questions you don't have an answer for. A doctor doesn't take the time to answer those questions. Are you feeling comfortable? You better find somebody else to ask, because that's not going to get better without some treatment plan.
Right. So would you recommend, I mean, is there a medication, or do you just get like some lube, or what happens? with
Yeah.
that?
If it's contact pain on intercourse, we have vaginal gels and creams you can use.
Okay.
And we do some blood tests. It found out that women's hormones are low, but primarily testosterone. So we add a little testosterone to the replacement regimen,
Okay.
And we can do that naturally too.
Okay.
It's not like you got to go on some hardcore testosterone supplement
Okay.
where you're sitting there and next time the side effect is that your voice changed, your hair falls out.
I went through that with you.
Right.
Yeah.
You
Remember
did.
that? Do you remember that?
Well, speak to it.
I naturally have a deep voice for a female.
Okay.
And I went to see him, and I had don't mind sharing, partial hysterectomy.
Okay.
What was I, in my early 50s or late 40s? Anyway, I came in to see him, regular, visit, and he said, "Why's your voice so deep?" I was like, "What are you talking about?" And he gave me a blood test, and sure enough, my testosterone was
high.
it was sky high.
Wow. But
And-
you hadn't taken anything. You just
Well,
was-
I had been on my replacement therapy, but I don't know
Oh, wow.
what happened because it's a fine line to keep all of that balanced.
Wow.
And and so I didn't notice because my husband, when he's overseas, I can call over there and they'll say, "Just a minute, sir." So I'm just used to it,
Yeah.
Yeah.
having a deep voice, and
Okay.
he recognized that,
Yeah.
let's get some blood work and see what's going on because your voice is just too deep,
Wow.
and it
Interesting.
turned out my testosterone was
Now,
up
did you
there.
have to give her something to take it down, or just naturally? What happened with that?
I forgot.
Well, number one, we took off the medication she was
Oh,
Yeah,
on
that's
okay.
true.
That'll do it.
and
what
talked
that
to her
was.
about some natural supplements
Okay.
to maintain it. But it's a matter of fact that it's not just women going through the change of life. There are young women taking birth control pills and just the type, whether it's the Explanon, Implanon, the implant, or some birth control pills have higher levels of progesterone, and
Okay.
then that level actually kind of converts to a testosterone base. And the thing about it is that you stop the hormones, you stop the birth control pills, but the symptoms are there for a minute. And you have to make sure that you look at every aspect of why someone goes through the change of life. So people who actually are healthier, the change of life is a lot easier. People who go through the change of life and it's just like they're not ready. It's like there's some overriding fear that I'm going to go through the change of life, and that fear is you are going through the change of life.
Yeah.
And let's deal with it such that you can alleviate those fears. And those
Yes.
fears can be alleviated not from rumors and TikTok, and YouTube.
Right.
Talk to the source.
Yes.
Call me, call other healthcare providers. I'd be very careful in looking this up on YouTube because your tendency is to get lost. Too much
So many
information, and
different-
information is
Yeah.
Different
conflicting.
opinions.
And you are, you're you.
Yes.
I don't think everything is just tailor-made for a generation. You got African Americans tend to go through a later change of life, and due to hormonal variation, they also tend to have less symptoms, a lot less something else that's going on.
Okay.
So if you have a hysterectomy and they take out your ovaries, that's a surgical menopause. That's like, in essence, being on drugs and someone said, okay, now you're going to go cold turkey.
Right.
The menopause can be harsh if you go through it surgically without treatment. And maybe a healthcare provider say, you're okay, you'll get through it. Give me another choice, doctor.
Yeah. Yeah.
Other than
yeah.
just bite a whatever and get through it. Now, menopause is complex, and it can be as tough if you want it to, because all the variables that we're talking about. We're talking about your brain, and whether you're going to get early onset dementia, or either you can't remember things, or either if you look at your body, start changing shapes. You know what I mean? It's like all of a sudden that
You had to mention
Coca-Cola
that.
ball turns into is that your
A keg.
No, and a lot of that is centered usually is central obesity or weight gain, and it's due to all the starches.
Yep.
What are you cracking up about?
Man, because it's real.
It is.
I can just,
Absolutely
I seen
is.
my Coca-Cola bottle turn into a keg, you know. What the what?
Absolutely.
Okay, you
And
said
know
a
what?
keg. Okay.
If you don't laugh about it, you're gonna cry.
Mm-hmm.
So I take it grain of salt. It's just
And,
funny.
I would want to say, too, that, for you ladies out there listening, not every woman goes through the same stuff.
Right.
You know
That's
what I mean?
facts.
Not every woman is going to have sexual issues.
Right.
I have an aunt that barely even had hot flashes that floated right through it.
Wow.
And so some women really struggle. Others, mine was would you say mine was brought on by
Surgery.
the partial surgically
Yeah.
brought
Yeah.
on?
Yeah.
So, but the only thing that I really had difficulty with was the flashes, the hot flashes.
Yeah.
Now the mental thing, I'm still on the phone looking for my phone, so I don't know if that's
The
part
jury's still
of-
out on that one.
I don't know what that.
what that is.
That's probably too much on your
Or
mind.
my glasses on my head and I'm looking
Right.
for them, but other than that, I was able to, like I said, I was able to kind of go through it and move through it, and then once you recognized just by listening to my voice
Yeah.
that I needed to pull back on some of the medication that I was on.
Okay.
So-
Okay, so I believe that question was answered. It can affect the sex drive, if you get dry, and there are treatments for that. If you want additional information on what type of treatments or exactly what to do, again, that number for Dr. Johnson will be at the bottom of the screen. And again, I'll make a post so that you all can reach out to him if you wanted to go a little deeper with that. All right?
And this is a game changer. If you're having these problems, please reach out, call me, because it's not going to get better unless you get some help in solving this. Because you're in a relationship, and then not only the vagina gets dry, you have pain on intercourse, you start losing bladder function, you start urinating on yourself, incontinence, and just an uncomfortable feeling,
Yeah.
vaginal discharge changes that we just have to build up the integrity of the vagina. But that's not that's not all the story. A lot of that starts from the hypothalamic pituitary area, and we got to get these hormones
Yeah.
squared away too.
Okay. Okay, so that'll be good. Question number 2, do I need to take something separate for my irritability?
Maybe, but I think that if you treat it's called root cause analysis.
Okay.
So if the root of your problem is you're going through the change of life, and you go, your hormones are waxing and waning, that has to be addressed first. Sometimes, unlike hormones, say you're hypertensive, and you come in my office and your blood pressure is off the roof. So number one, I treat that first because I got to get that blood pressure down, and then I go into researching the cause of it. But that blood pressure has to get down to a normal level. I think that sometimes when you come in, we do blood tests, and the blood test is the indicator just really how far you are in the menopause and how bad it is.
Okay.
So the numbers get to be so high that we say, we have to get the numbers in a range of what's considered to be normal. And in most people, it should be less than 10 FSH and LH. It's a 20, it's premenopausal. Above 40,
Okay.
it's postmenopausal. But if you're 40, postmenopausal with no symptoms, you just didn't change life. So just go on. But you should, it's like the story of David and Goliath. Now, Goliath is a fact of life in everybody's life. I mean, the trials and tribulations you have to go through in life.
Yeah.
And that's your Goliath. And you as David, you can't run from the Goliath,
Right.
and you can't ignore it.
Right.
Right.
So, like David, he said, "I got this," He got a slingshot, and he was running toward Goliath.
Right.
So we have, sometimes we have to attack these symptoms
Yeah, that's right.
and make sure we get them under control. But don't think that the menopause, and you treat one thing, that's going to take care of everything. So some things need to be treated separately.
Separately,
Yeah.
okay. You know what, because I can say, when I first came to you and I was just like explaining and I felt like I was sitting in a puddle of water all the time and it was causing me to be extremely irritable and, just mad. And then you gave me the treatment for the issue and it actually fixed.
Are you
It
better?
calmed down.
Are you better?
Yes, I'm much better, and I'm not as irritable. Now, it takes a lot, now to just kind of poke me. I'm back to my normal self with the tolerance is higher now.
But a word of wisdom to the partners, the husbands. If my wife comes in from work and I say, "Honey, how's your day?" I don't ask her what's for dinner. I'm going like, I got the dinner covered. No, it's like some of the things you do in life. It's just we're living in a contentious way of life. Everybody's on edge.
Yeah.
True.
People don't just say like you said to him, "You're doing a good job." That was not solicited, but I'm sure he felt better just saying,
Absolutely.
"Hey."
Yeah.
So sometimes,
It's appreciation.
yeah, we need to
Yes.
encourage each other, and the patients who's going through some fear associated with this need to be encouraged, and not from a contentious way. "Oh, girl, you're gonna die because these hormones." There, it's like, whoa. That's like me telling a lady who asked me,
Freak us out.
"Is it gonna hurt when I have a baby?" I'm going like, "I'm a man. I know it's gonna hurt, but I can't tell her it's gonna hurt." I say, "You know what? Women have done this for years.
Yeah.
You're gonna do well, but you just
Favorite
can't
words.
can't
Yeah.
be. You have to be optimistic about it."
That's good.
It's all in
That's
the approach.
Yeah,
That's good. Okay, so
but it does hurt.
Yeah,
I think it
I
hurt
can contest to
bad.
that.
I have a daughter expecting. I tell her that's where the love comes from. That's where the going through that. That's
Yeah.
where the love comes from. 'Cause after you
Yes.
go through that kind of pain, you are loving that individual.
I bet y'all probably, some men kind of go through it a little bit when the woman is giving birth and they're trying to hold the hand and you're squeezing the hand till knuckles pop, or they're scratching you like, "Shut up, I said to."
Yeah, no, they
So
did
y'all take some of the pain.
but they did a comparative study because some silly man said, "I don't know." I think Charles Bartlett said it one time. It's like, "I don't know if you whining about it's like a basketball player getting a sprained ankle or this and that. It's no comparison." So they got men and they hooked them to a TENS unit.
Oh,
Good.
yes.
Good.
I've seen something like that, yes.
I think they got last 10 minutes.
And scream like a girl.
Yeah. Oh, I've seen some last less than 10 minutes.
Yeah. No, we need to be
Sweating
more
and just upset,
appreciative.
like, "Just take it off. What are you doing?" I'm like, "Oh, okay.
Now.
Sprained ankle, huh?"
Yeah. Take your bottom lip and stretch it over your head and see how that feels.
Right. So bottom line, yes, at times you do have to be treated separate, but if you treat the menopause symptoms, some of the irritability will go.
Absolutely.
Will go. So,
Absolutely.
And I am a witness, like I
Yeah.
said, to that, and I am much better. So thank you so much. But I need to call you too, girl. We got to talk. All right, so.
Nate, I have a quick question.
Yes.
Doc, would you recommend over a certain age that we have blood pressure monitors because it's a silent killer? And like you said, you had the lady came in and her blood pressure was off the
Oh,
roof.
yeah.
And a lot of times you don't know because blood pressure, unless, you may find out after you've passed out. But would you recommend that after a certain age, maybe you get you something just to kind of monitor for yourself?
I need you to do it before that certain age because hypertension is a silent killer, especially in African Americans, Black African Americans. But that's a real good conversation for another podcast because I want to do justice to it because the range for a blood pressure reading in African Americans, Black African Americans, I'm saying if it's 135 or 85, that's kind of high to me. And everybody else like 140 over 90. Yeah, that's a general number. But if you look at obesity, that may drive diabetes, hypertension, heart disease, et cetera, et cetera. So you look at hypertension. How do you get to that situation? Is it genetic, hereditary, your adaptive lifestyle? African Americans I think the stresses in life, of life, affect African American people in general. So you could have everything going for you, but it's like a black successful woman. It could be a lawyer, could be a housewife, it could be just it's just they come in with this added thing of just the inherent stressors, and we're trying to figure out what is it. Is it dietary? A little bit. If it's weight, a little bit. You correct all that, and then you look into a person's life, and it's the stresses of life. Just being black, just being a woman, and the things you have to do to compete, because women ideally decide 75% of all the health care needs for the family, but everything else too.
Right.
So then again, you come home and you got to take someone to school. You got to
Yep.
make sure your husband
Yeah.
is squared away, and then
Yeah.
all of a sudden they leave, and then it's not like it goes away.
No.
You may have to go to a job, but hypertension is a good subject to
Okay.
address. So
Okay.
so I start telling people I think at risk to take a low dose adult aspirin, maybe at 35. I put them on medication that we know homeopathic can reduce stresses, like turmeric, like I was telling you, it's ginger. But it's like you come home and you're trying to get settled in the house, but you never get settled.
Oh yeah.
I mean, you're on like a
A mouse on a wheel.
yeah, and it's like I mean, you need to get off of it for a minute
Yeah.
and see how you can do some things for yourself. But
Right.
that's hard to do. It's like people say, "Well, Dr. Johnson, why come you haven't retired?" I'm going like, how can I retire when so many unsettling things out there that affect black women
Ooh, that's
that
good.
I'm not going to leave a void in the system until I get some other doctors to help along
Wow.
the way. So we're working on that. But I tell you, we should do hypertension again. I can bring Dr. Terry Richardson. She's the internist, and we can actually take off the kid gloves on that subject, because that's
Okay.
one that we as black people need to take ownership of it
Absolutely.
and deal with it, and not like I don't need to take my blood pressure medicine anymore because I feel good.
Right.
It's like, and then I realized that my blood pressure, my numbers are good. It's like your numbers can be good, whether you're diabetic or hypertensive. You get the numbers normal, but you're still hypertensive and you're still diabetic.
Yeah.
You're taking means to get the level down. So we just make sure you continue that, because I think that happened to Luther Vandross, famous singer. He was diabetic, and he was it was the big Luther, the small Luther. The big Luther could sing better now, but all of a sudden he lost all that weight, and then his numbers got better, and then he stopped taking some medication, and then boom, it
Yeah.
happened.
Yeah, well, definitely, that's going to take a whole nother time when
Yeah.
that's all that we're talking about. And I agree with you. Hypertension is that's a subject. That's a whole subject by itself. So we'll definitely have you come back, and you'll reach out to Terry or
Yeah,
give me the
and
information.
we
Yeah.
can cover preeclampsia and hypertension in pregnancy.
Yeah.
That's becoming
Yeah, let's talk
prominent.
about it.
So yeah,
And I think cholesterol's mixed in there with
oh yeah,
it too.
yeah, the whole
Yeah.
thing, yeah.
Okay, well, we'll talk about that. We'll talk about that. All right, so someone has asked, does depression and menopause go hand in hand? In other words, will her depression get worse while she's in
Yeah.
menopause?
And I think depression is one of the first telltale signs of menopause that goes unnoticed. We just think you're sad, you're depressed,
Yeah. Ooh.
not realizing that if you look at it in context of why is that person depressed. And it could be hormones. The hormones are imbalanced. They get depressed. So we as a medical society, I'm depressed. Okay, let me give you Lexapro. You come back later on, I'm still depressed. Let me add another blood pressure. Have you ever taken a look at what's really the cause effect of the depression? Whether you're going through the change of life, whether it's early signs of MS, it's early signs of just heart disease or anything. Because I had a lady came in my office, and she was just anxious. She said she was depressed, but she was very anxious, and she couldn't keep still. So I thought either she had a kidney stone, but it wasn't pain. And I looked around, I looked at the lady. I said, I don't know what this is, but you're not leaving my home, or not home, my office until we figure it out. I still was concerned. So we sent her to the hospital. You know, she was having a heart attack right in front of me.
Oh my
Wow.
goodness.
And the subtle sign, that first sign was anxiety.
Wow.
Oh my goodness.
But I didn't know it, but I learned it.
Yes.
But I was not going to let her leave that office.
Yeah. Oh, well, good for that discernment too.
Yeah, so you look at women, the anxiety could be related to, we put everything on stress, but it could be a heart attack, it could be thyroid disorder, it could be a lot of different things. But we are such a subtle healthcare providers that we just, I don't know, we don't take the time. I hate to say we don't care. We're just
Pay
trying to get the
attention.
numbers, get people through, and then you realize that you missed something. Like, okay, you go to the emergency room as a black male, and all of a sudden you have chest pain. Doctor was invariably let that person go, so you got indigestion or heartburn, and the person goes home and have a heart attack. I'm like, wow. And where's the liability on that? Who's responsible?
Who's
for that?
responsible? Absolutely.
Wow. All right. So, again, I think just wrapping that question up is that it can worsen it, but it can be treated
Oh yeah,
along with the menopause
Yeah.
treatment.
The key is
but if it's something
recognizing.
separate,
Right.
Just
then-
recognizing,
Yeah.
and
Okay.
reaching out.
Yeah.
And some of the depression is factual. It's like if you got family issues, job issues, sometimes you may have to see a therapist if indeed, depending on how serious the depression is. If I ask you questions and you think you're about ready to jump off a ledge,
Yeah.
you're not leaving the office again
Right.
until we get this
Appreciate
resolved,
that, yeah.
because all of a sudden is it that bad, the depressions? So it could be like I said, menopause, but let's be thorough and make sure we're not missing anything.
Okay.
Getting myopic and just thinking about menopause.
Okay.
And look at all other things that lead to depression.
Okay. All right. So there's that part. You can call them to talk a little bit more about that. All right. Let's see. I am forgetting more often since in menopause. Is that normal?
Yeah, that's normal, but it's a process of aging. Aging is the primary focus for that. So if you think you have issues remembering where your glasses are or your phone and it's in your hand on your head. So, people have commercials about Prevagen. I used to recommend ginkgo biloba, but you need to feed the matrix of your brain. So that's why get the cholesterol level normal, be healthy, drink more water, antioxidants, but you have to exercise that brain. It's like, okay, if you can't remember where you put your keys, then put a key rack up by the door or something.
Yeah.
Work crossword puzzles.
Yes.
You come to my office, don't come there trying to speak extemporaneously about, I'm sick. You better be
Yeah.
more specific.
Yes.
So I encourage people to write down
Yes.
their questions and don't leave that office until these questions
Yeah.
are answered, and you also in turn write down the
The
response.
response.
Yeah.
Yeah, I remember you said that last time, and that was great advice. I remember several people saying, I hadn't thought about that, but now, I'm going to write my questions down. I'm going to go in there with this with this list and, ask these questions.
And for the caller who wrote that question, we as a people are living longer. And we're living longer, but are we prepared for it?
Oh,
I'm telling you, aging sucks.
yes, it does.
Every aspect of it. I looked in the mirror the other day. I went, "Who in the hell are you?" That's not the person. I said, "This is it. We got to roll with it.
Right.
So let's get it prepared." So
Yeah.
so I don't know. You have to making sure you're eating properly, exercising, walking,
Yes.
drinking water, eating healthy. So instead of getting up in the morning and doing pancakes and we talked about bacon.
Yeah, we were talking
Bacon,
about
the
bacon before we
bacon,
got on live.
I mean, you may have to switch to oatmeal,
Yeah.
Cheerios,
Yes. Fruit.
fruit. Yeah, fruit. And then, you know what? Have your coffee, but maybe if you're drinking more than 6 cups of caffeine, that could eventually give you a heart attack.
Ooh.
Or give you extra heartbeat, PVC. So if you're going to do coffee, I'll say maybe 2 cups a day,
Okay.
not 2 mugs a day.
Right.
You know what I mean?
Thermoses.
Because that caffeine has an adverse effect, like nicotine, on women's hormones as well as their
Yeah.
body going forth.
Yeah.
Even like stuff like Alzheimer's syndrome. One of the symptoms of that is depression. It's like you're irritable. If you had anybody in your family who had dementia, they can be mean.
Mm-hmm.
Yes.
Absolutely, they can.
And then again, it's like, how do you treat that? Is there any medication to treat it? Yeah, but how do they get there right in front of your eyes? I mean, couldn't you have kind of defined some of those symptoms, take it to healthcare office, and then, but in essence, they still don't get it. So somebody in this country, whether it's the government, whether it's the church, whether it's citizens, is going to have to give and care about people.
Yeah.
I think we've kind of lost
That
that.
part.
True,
Yeah.
true.
Yeah.
One thing I was going to say, piggybacking, Doctor, when you're saying we're living longer, for me, it's all about quality of life.
Right, there you go.
Because you could be here and not be here.
That's true.
And for my goal or my prayer and my hope is that I could keep my mind so I can pray and keep my health so I can serve. So if I can keep those 2 things, I can figure out the money, I can figure out everything else. But I saw, it was, if everybody gets a chance or an opportunity, it's called Live to 100. It's a documentary on Netflix. And it's called Live to 100,
Yeah,
The
you told me
Secrets of the Blue Zone. And there's places in the world where people are living to well over 100 years old, and there is no Alzheimer's. And in some of these places, they do not believe in putting their loved ones in nursing homes. They don't even have.
No,
they don't even
take care
have
of it.
nursing
Yeah.
homes. And so, if we're gonna, you have to make those life adjustments in order to make it for as long as the Lord has for you to be here.
That's right.
And you want to be here and have some quality of life and function rather than just be laying up in the bed with tubes and
Yeah.
because that's not living.
Well
Right.
said.
Yeah.
I agree.
Excuse me. Yep, that is correct. What does the body lack most during menopause? Menopause.
Well-
Menopause.
What do you say?
I said menopause.
Well, in menopause,
That's a new one.
Right.
let me write that down.
Right. Come back with that one. Now you're gonna have to go research.
Yeah, we're gonna check your hormones today, girl. I think that they all have an important part to play in menopause. All the hormones, and even thyroid, and even enzymes, adrenal gland, the cortisol. But the main one is estrogen.
Okay.
Estrogen, to me, is a woman's best friend. It's a thing that sustains you. It's the thing that gives you the curves, the smooth skin.
Hey.
And it actually protects your heart, the estrogen, until you go through change of life. Then we have to figure out a way to replace it as naturally as the body produces it.
Okay.
So when you look at the healthcare system, we used to give you, we still do, Premarin. You know where Premarin comes from?
What?
You know?
I want to say, but I'm not sure. Not a pig.
No, it's a horse.
Oh, well,
we
I
take
was in the
we
farm.
take the urine of a horse. So, I don't know. I have to probably
Wait
have
a
to
minute, and give it to us in what form?
peel or cream. But let me tell you this.
Yeah, talk about that.
Let me
I'm
tell
not
you,
sure most people gonna want to be putting horse urine on in their tummy.
but I don't think they really knew until put more emphasis and stress on where the medication comes. So I need to start this off by apologizing to any and every woman that I have offended in life, but it was not intentional.
Okay.
So, a lady came in and she was taking Premarin, and she was taking a lot of it. And she said, "Well, how do you know when you had enough, Dr. Johnson?" I said, "When you start." She didn't. She didn't laugh. She didn't laugh but a minute, but later on she got it. She said, "You crazy, doctor." No, but I think that let's give you another viable substitute that you can take other than a horse's urine.
Yeah.
Some bioidentical, you know?
Yes. Come
Some
on.
natural.
Plant-based.
Plant-based.
Yes.
Sorry.
I would
Yes.
be a little upset if I got that and knowing what it was. I'd be like,
No,
take that.
But I'll tell you, it worked. But then the long-term side effects of estrogen also, we increase incidence, not very much, but breast cancer.
Okay. Yes.
But deep vein thrombosis. So the estrogen helps prevent dementia. It helps with the brain, the heart, colon cancer, bones. So estrogen is really important. It's just how you want to distribute it
Yeah.
in the most viable and healthy form. Healthiest form.
So in menopause, our body stops producing it.
Right.
Okay.
Well, it's like
As much. Maybe.
yeah, right. The estrogen that you probably get probably comes primarily from the ovary, and once the
okay.
ovaries are gone, then also you got some from the adrenal gland, and also you get a little bit of estrogen from adipose tissue. So women who appear to be overweight are still producing a little bit of estrogen, but you want the natural form of estrogen that your ovaries are producing, but it's hard to
Yeah.
mimic that. Yeah, it's your ovaries.